Hi, my name is Shay, and I will be talking about elimination disorders. This particular slide presentation deals with a scenario involving a 6-year-old male patient. His mother has brought him to the pediatrician's office because he's been wetting his bed for the last year. She is concerned about his emotional state and the impact that it has on his social life as well as his self esteem. Bedwetting has been occurring with this patient every night for the last year with occasional dry nights. He has been dry during the day since he was 3 years old with no reported accidents. The patient expresses embarrassment when he has sleepover or stays at friends' homes. His mother is concerned that he is sometimes anxious about going to sleep in fear that he might basically wet his bed. He is currently wearing pull-ups when he goes to bed at night and is embarrassed by having to wear those pull-ups or anyone seeing that he does wear these pull-ups. The family recently moved to a new neighborhood, and Liam is down at a new school, which obviously adds stress for anyone who moves to a new place. He's also feeling left out during play dates with his friends as they kind of talk about, bigger kids not having to wear any diapers anymore. There's no significant medical issues with the patient whose name is Liam. And the patient was basically referred to the psych NP from the pediatrician for further evaluation. So the question has been posed why the pediatrician will refer this case about Liam, the little boy, to a psych MP. Let's say, for instance, one issue could be Liam's case is more complex than just development. The child is experiencing emotional distress. The issue has been persistent for over a year, and the psych MP is the best place to assess the patient's emotional and mental well-being and to plan a holistic treatment approach. Now let's think about this. Bedwetting can sometimes be a developmental issue, but in Liam's particular case, it's a little bit more complex. Elimination disorders are often associated with comorbid psychiatric disorders and emotional or behavioral symptoms. Let's take into consideration that this little boy has been suffering with this particular issue for over a year now, and that the issue has been brought with this particular issue has been brought with a significant amount of emotional stress for him. The patient feels embarrassed and is anxious at bedtime. The problem is also affected his social life, including activities like sleepovers or play dates. It is therefore important that in this particular case, that the psych MP assess the patient to evaluate his emotional and mental health. A diagnosis will then be arrived at, and a treatment plan can be developed to help the patient. Now, in order to develop a treatment plan for Liam, we need to ask some assessment questions to get a kind of better understanding of what's going on with Liam, and to again rule in or rule out particular diagnoses. One question that we might ask is, do you wet the bed every night or just some nights? The question about frequency is meant to assess whether the frequency meets the minimum DSM-5 threshold of 2 times a week for a minimum period of 3 months. Another question that we might ask is, do you ever experience accidents during the day? Now, when we ask this particular type of question, basically what we're trying to find out is if the person if the person has any types of underlying medical conditions. Okay. Another question might be, do you sometimes feel like you have urgency or feel any pain while peeing? This question that we ask Liam is basically, again, to rule out if there's any possible bladder infections, or does he have a hyperactive bowel? Excuse me, bladder, is what we would do. Let's see. Another question would be, have you ever been dry for several months in a row? Again, this question helps us to distinguish between primary and secondary enuresis, and can it help to pinpoint stress changes that Liam may be having? And the final question we might ask him is, how is everything at home and school since he moved? The reason why we would just ask this question is again to see if there's any stressors that may have worsened the issue. Okay, so now that we've asked Liam some questions to kind of get an idea of what's going on, other assessment tools that we can use or tests that might be able to, again, pinpoint or what might be going on with Liam is a urinalysis test. Urinalysis should be done to carry out to rule out things like diabetes or other urinary concerns as the cause of the bedwetting. According to Gertz Broking, um, a dysfunction of the lower urinary tract can bring about urinalysis. Another assessment tool might be a diary of the frequency of both wet and dry nights, accompanied with notes of fluid intake and bathroom times, will also help to rule out any causes of bedwetting that may be associated with lifestyle and other symptoms, or excuse me, lifestyle and other aspects of his life. And finally, we might want to look at his sleep history. You know, Peterson and et al. Noted that sleep has a role to play in bedwetting among children. Thus, sleeping disorders can affect bladder control and should be ruled out as well. Now, the question becomes, what type of options for treatment can we use to help Liam currently with his situation? A pharmacological option could be a medication called desmopressin. It has been clinically used over the years in the management of nocturnal polyuria among children with enuresis. It functions by mimicking, the body's hormones that reduce urine production at night, and thus has the same effect as far as not producing that much urine at nighttime. And it is useful in short-term circumstances, like let's say if Liam was to have a sleepover or a play date in which he was over someone's house for a period of time. Another option, a non pharmacological option, could be cognitive behavior theory. And this is a therapy, that has been established to be effective non pharmacological option in the management of persistent enuresis among children. Beyond and et al. Authors noted that when combined with hypnotherapy, CBT improves bladder sphincters control among children with a bedwetting problem and is useful in the long term. So, right now, we do have an idea of, or we have diagnosed him with an elimination disorder. And now we've come up with a couple of treatments that might benefit Liam at this stage. If you have any questions, please just let me know and I will do my best to answer them. Thank you.